So it's great to be here, and it's really nice to follow Grace and the NANDA team, just to kind of give a plug for their work, which we've actually used their measure of essential work in a different paper. And also, if you're interested in the definition that they use, we also have code on the linkage library that codes their definition in both PSID and HRS, so that you can use the same measure in the microdata as you can on the geographic. Yeah, it's great. So I'm going to talk about what we know from HRS in terms of well-being of frontline workers during the pandemic. So we're going to switch a little from looking at the broader category of essential to a narrower category of frontline. So we know that during the pandemic, about 40% of workers were frontline workers. So if you saw from Grace's slides, if you look at the essential industries or occupations, it's quite a lot. It's like 70 or 80% of the labor force. Whereas if you look at the people who in addition were there in person, that's going to be a smaller, about 40% of the labor force. We know that if we look at the demographics of people who worked in occupations and industries in which they were likely to have been frontline, that they are less educated, lower wage, more likely to be immigrants and particularly Hispanic workers. But one thing that we haven't spent a lot of time talking about is that about a third of those workers were 50 years old or older, which is people who may have also been at more risk simply because of their age. So there's some work on outcomes for essential workers and frontline workers, and I was going to talk about the California death data, so I don't have to do that anymore. But using death certificates in California, you can see these spikes in excess mortality among certain types of frontline or essential workers at different points during the pandemic, and it sort of doesn't always. It's not always a super clean story of like it's always this whole group. Sometimes it's sections of that group. So we're going to take a sort of both a more bigger and smaller approach. So we're going to use longitudinal data so that we're going to sort of gain something on the idea that we're going to be able to compare what these workers looked like relative to other workers prior to the pandemic, i.e. prior to there having any meaning to this notion of essential work, compared to after the pandemic when that notion sort of took on meaning. So that's a sort of benefit, but at the cost of not being able to look at these very specific classes of workers or at very specific points in time like you could with information from death certificates. So what we're going to look at today is how frontline workers differed from non-frontline workers in terms of employment, time use, and health relative to the pre-pandemic period. Today, I'm just going to talk about health, but we've done a lot of work looking at these other outcomes as well, which I'm happy to talk about. And we're going to look at whether these differences were different at different points during the pandemic. So I should say this bigger project has used PSID and HRS. I'm just going to talk about the HRS work today. So one thing that's cool about the HRS is we do have data that's collected prior to the pandemic. So we're going to use a lot of information from the core before the pandemic and from supplements, time use supplements, et cetera, prior to the pandemic. And then we also have information at various times post-pandemic because different parts of the data collection happen at different times. So we have data in 2020. Actually, that data in 2020 spans the pandemic period. So we have people who are interviewed before and people who are interviewed after. There's also a mail out that happens in 2021 along with information about consumption activities, time use, and then the core in 2022. So we're going to be able to look at this kind of broader period of time. And one thing that's nice is that we can, again, compare what was happening here to what was happening here. And we can also use characteristics of the individuals in the data set that are measured prior to the pandemic to control for things, pre-existing kind of factors that differ between these groups. Okay, so our main sample is men and women between the ages of 55 and 64. We're just focusing on a set of older workers who we can measure at consistent ages across this period. We're going to look at what we're going to call frontline workers. So that's people who worked in essential industries according to CCC, the same ones you saw. And then we're going to use some data that Bruce worked on early in the pandemic, actually, to then also layer that with working in an occupation that has a low ability to work from home. So your frontline and both those things are true. So this is all, we're going to classify individuals based on what they did prior to the pandemic. So everyone, we're not going to allow for like switching during the pandemic, right? I should say we've also looked at everything according to whether people told us that they were an essential worker, and none of our results are sensitive to that. So even though we thought this might matter a lot, it doesn't turn out to. So again, what we're going to do is compare differences in outcomes between frontline and non-frontline workers prior to the pandemic and frontline and non-frontline workers after the pandemic. So we're going to be looking at whether the differences are the same across time or if the differences change over time, right? So if I give you an example, if we were going to look at BMI, we would take BMI measured in 2018 and regress that on whether you were an essential worker in 2016. So that is using the 2020 characterizations, go back to 2016, would you have been a frontline worker? And control for covariates in 2016 and look at the difference between frontline and non-frontline workers. And then we're going to do the same thing in 2020 and 2022, where we use your frontline worker status in 2018, characteristics from 2018, and outcomes from 2020 and 2022. And then we're going to compare those coefficients, okay? So in everything we do, we're going to disaggregate by gender because men and women actually engaged in very different types of frontline work. And one of the reasons I think that the narratives around this are so confusing is that a lot of the literature was based on like very specific samples and very specific types of workers at different points in the pandemic. So I think when people think about frontline workers, a lot of people think about grocery store workers or nurses, for example. But if you looked at that set of industries, lots of them were also, like for the men, a lot of them are doing things like working in water treatment or working in agriculture or working in mining. So here, if you look at the occupations and industries that our frontline workers do by gender, you can see if we look at the occupation, lots of the men are involved in sort of natural resources and construction, whereas women are more in professional occupations. But when you look at industry, you can see that the men are much more concentrated in things like agriculture, mining, and construction, where the women are in healthcare and social assistance. So we do see that they're engaged in different types of frontline work. And so in everything we do, we're just going to disaggregate results by gender because there's actually no reason to think that the risks of being in these occupations were the same, given that your proximity to other people is going to be really different, potentially if you're working in something like water treatment plant where you might not be that close to other people versus a hospital where you might be close to people all the time, or where you might have access to PPE or not have access to PPE. And I should say, while we can categorize occupations and industries, the samples are going to get really small when we look within these. So we have disaggregated our results by occupation and industry, but we have really small cells in some of these. So I don't want to put a lot of weight on within occupation and industry differences, which is why we mostly look at gender differences. Okay, so this is going to give you just a sense. So as I said, I'm going to focus on health today, and I'll talk a little bit about what the results on time use say. So I'm going to first we're going to talk about mental health, then we'll talk about physical health, and then I'll talk about some other aspects of health. So here, what we're looking at is the coefficient on frontline work. For different aspects of mental health, and these come from the Leave Behind survey. So this is looking at differences between frontline workers and non-frontline workers in feelings of being hopeful, nervous, feeling that you have a sense of worth, and sadness. And we can see what I'm showing you is the coefficient in 2018, 2022, and 2022, and then also the difference and whether that difference is statistically significant. Okay, so what you can see is there's not a ton of baseline differences. That is, even within each wave, there's not a ton of differences between frontline and non-frontline workers in these measures of mental health. And with the exception of hopefulness, there's no statistically significant differences between these workers in the pre versus post-pandemic period. So this is the only place, I'm going to warn you, this is the only place of any outcome we've looked at, I think, that we get any statistically significant differences. And I think we've looked at, like, I'm going to say 50 outcomes. So we don't see, we've looked really hard. Part of this has been a digging exercise. We've looked really hard, and we don't see a lot of differences in outcomes at this level between these workers. So in mental health, we don't see a ton of action either in the baseline or in change over time. When we look at physical health, we also don't see huge differences in baseline. Here we looked at BMI, the number of drinks you report per week, and physical activity. So these are kind of measures of health behaviors. We don't see large differences in between these workers, frontline and non-frontline workers, in any period, and none of the differences are statistically significant. Yeah. And then we looked at a broader set of outcomes. So this is depression, this is activity limitations, this is a measure of chronic pain, and this is a measure of sleep problems. Here, what I'm plotting is the difference and the confidence interval of the difference. So if you compare it to here, I'm plotting the confidence interval associated with the difference, what's over here. And again, we don't really see any differences in these older workers in these outcomes either. So as you can imagine, okay, we've been working on this project for a while because you heard me present it last year, right? And so when you see something like this, you're like, what's going on? We thought we should be seeing differences, right? So I will say that we've really gone in a lot of depth to look at lots and lots of outcomes and in multiple data sets. So we've, just to give you a little, we've looked at work outcomes, and we've also looked at time use outcomes. We've looked at these in older workers in the HRS. We've looked at them among all working age workers in PSID and just among the older workers in PSID to see if that we could replicate that. And we've created like harmonized measures between PSID and HRS so that we can compare. And we really see very few differences. And so we wondered why. So one reason is that we actually, if you remember in HRS in 2020 and in 2021, people were asked about their experiences during COVID. So we just look at differences between people who were frontline and not frontline. And what we can see is that part of the reason we're not seeing any differences in the outcomes is that they didn't really report differences in COVID experiences. So they weren't more likely to report financial distress. They weren't more likely to get COVID, and they weren't more likely to report that their income went down. So one thing that we're seeing is that they're not reporting that there's differences during the pandemic. And so we then don't see any of the things we would expect to see after the pandemic, right? And we also have looked at mortality, and I will say the mortality is tough because not that many people die in the HRS every year. And the 2022 mortality data is not ready yet, but in 2020, there's also no mortality differences. Again, these are like small samples, so we wouldn't expect to see them in the way that we would in, death certificate data. But so, we're still like chewing on this, but I think that what we're sort of thinking may be going on is that maybe the frontline workers were much less likely to like lose their job, right? Because they were continuing to work. So it could be that we have this sort of substitution where you didn't face as much financial distress, and so you didn't have the bad outcomes associated with financial distress. That being said, we don't see differences, right? It's not like one group is seeing some, it's that there's no differences between the two. So this is still a puzzle, but I think we're becoming more confident given all the comparisons that we've done in these nationally representative data sets that at least for the set of frontline workers, we can say something about in like a population representative way, that we're not getting big, long-lasting differences in outcomes. That does not mean there's not differences in specific sectors and at specific points in time. We just don't have the data to measure that. But I think we can say something about the broader group. And I think also this ability to control for what the differences between people demographically and based on their pre-pandemic characteristics may be playing a role there, right? So instead of just comparing outcomes, we're comparing outcomes controlling for the differences in characteristics between these workers. So I'm hoping that you have more places that we should look or more suggestions of what to look at because, we've been puzzling around this for about 6 months. And I think, if you can think of other things that would help us kind of tease out why we might not be seeing these differences, I would really appreciate your feedback. So thanks.